this is the humerus. From certain bone markings that we know that this is our anterior surface. And then this is our posterior surface. And we'll explain the reasoning behind that in just a few minutes. The first thing that we should mention is that this here is the head of the humerus. You can see it from both the anterior and posterior side, but this is the head. And this line going around the head is referred to as our anatomical neck. It's right here if I were to wrap my fingers around it. We also have another neck which is called the surgical neck, which goes around right here. And again, I'll wrap my fingers around it. This is our surgical neck. Right next to the head, we have two tubercles. We have the greater tubercle, and then we have the lesser tubercle. And these get their names due to the size, I believe. So the lesser one is smaller. In between the two tubercles, we have the intertubercle groove. And this is also called the bicipital groove. Right next to them, we have the medial lip, which is the crest of the lesser tubercle. And then we have the lateral lip, which is the crest of the greater tubercle. On this anterior surface, we also have the deltoid tuberosity, which can be found right here. And it's rigid. On the posterior side, we have the groove for the radial nerve. And I'm not exactly sure of its location, but I believe it begins right up here and it ends up wrapping around and crossing over the humerus. If this is incorrect, we'll fix it in the next video. There are 3 facets or impressions that can be found on this greater tubercle. And if you lay your fingers on the tubercle like a trumpet almost, your 3 fingers, you can find these facets or impressions. This top one right here, this is our superior, also the anterior facet or impression. Next, we have the middle facet or impression. And then lastly, we have the inferior, or also called the posterior facet or impression. And this is our proximal region of the humerus. And again, this is the anterior side. And then this is the posterior. This is the lateral surface. And so with knowing this and how the body works, this is our right humerus. If I were to put it in my body, this is my right humerus.